Fibroids can affect the fertility in a woman in different ways. It will depend on various things like their location, the size of the fibroid, and how many fibroids there are. Are we dealing with one fibroid or many of them scattered around the uterine cavity? Whilst many women with fibroids will tell you that they have been able to carry pregnancies quite successfully and have had no difficulties, that unfortunately is not the case for every woman who has been given a diagnosis of fibroids. And for this group of women, fibroids can interfere with various aspects of the reproductive process. The first way that fibroids can affect fertility is by the potential distortion of the uterine anatomy. Large fibroids located within the uterine cavity, so these are the submucosal fibroids, tend to distort the shape of the uterine cavity, making it difficult for the fertilized egg to implant and to grow properly. This increases the risk of implantation failures, early pregnancy loss, miscarriages, or complications during pregnancy. When submucosal fibroids are large enough, they share the space within the uterine cavity with the growing fetus. And so that means that the space that the baby will normally have to freely grow can sometimes be halved. And when these women are able to carry the baby full term, what happens is that there is intrauterine growth restriction, leading to the birth of the baby that ends up being small for their gestation age. Studies have shown that fibroids that do not distort the anatomy of the uterine cavity, mainly the intramural fibroids, will not tend to affect a woman's ability to fall pregnant. So, if you have been told that you have fibroids, the first thing you should be asking your doctor is, "Doctor, which type of fibroids do I have?"